All right, we all know whether we practice it or not, exercise is a key piece of staying healthy. Plenty of studies have found how regular workouts can help ward off things like colds and flu. We're emphasizing the word regular for a reason this morning.
That's because a new study found intense exercise could have the opposite effect, opening you up to these infections. To break it all down, we have our 9 News medical expert, Dr. Payal Kohli, with us this morning. Dr. Kohli, good morning.
Good morning, guys.
Thanks for coming in.
Yeah, my pleasure.
All right, so Dr. Kohli, we have all heard that exercise was important to keep our immune system healthy, but this new study suggests otherwise. What exactly did they find?
You know, it's so fascinating because as a cardiologist for a long time, we've sort of known that too much exercise can actually increase your risk of medical conditions like arrhythmias because it can change the wiring in the heart. But now that we're getting some data about the immune system, it's really very eye-opening. So they took a bunch of firefighters, they put over 40 pounds of gear on them, and they made them hike in humid weather for about 45 minutes. And then they looked at their saliva to look at what the chemicals were doing, what their immune system was doing really. And what they found is after that kind of an intense activity, they actually had less protective immune chemicals, maybe increasing their susceptibility to respiratory infections or colds.
Oh my God.
Do we know why that might be the case?
Well, we have a few theories as to why. So the first is when we exercise, how do we breathe? We kind of gulp and swallow air through our mouth, not as much through our nose, right? And so it bypasses the barriers of the nose, which are those little hairs that filter a lot of the particles that are going in. The other is that our body is so kind of busy redistributing blood flow for exercise that our immune system gets distracted. So it actually reduces airway inflammation to help us breathe better because that's an adaptive mechanism. But you can imagine right afterwards, especially after intense exercise, we're sort of turning off our immune system.
Right.
So those few hours after, we might be more susceptible.
Oh, man.
Sounds like there's a balance here. So
Very much.
How much exercise is too much?
Okay, so this is what's so complicated because there's no formula that's right for every single person, but there is a U-shaped relationship, meaning too little, of course, is bad for us, but I cannot emphasize this enough, too much can also be bad for us, not just for our health, for our immune system, but also for our joints, our bones, those types of injuries. So we need to figure out first what our exercise goals are. Are we trying to lose weight? Are we trying to get cardiovascularly fit? Are we just trying to sort of stay in shape, keep our muscles and bones going?
Right.
We need to see where we're starting out, how healthy we are. And then what I like to do with my patients is based on those parameters, actually write out a little prescription. So I take a piece of paper and I write out how much exercise. For most people, it's 30 minutes, 5 days a week of kind of moderate intensity exercise.
Okay, gotcha. Yeah, I was going to ask about that because, look, in Colorado, we got a lot of healthy people who like to do everything from hiking, skiing, mountain biking, all that stuff. Is there maybe like a heart rate zone, if they track that they should stay in? Because my partner and I go back and forth on this all the time. He likes to run marathons, and I say he trains too hard.
Yeah.
But that's also me who doesn't like to run.
Well, you know, it's funny, as cardiologists, we've looked at people who run marathons, and after they run a marathon, they actually have signs of injury to the heart muscle.
Yeah.
Because the heart's been kind of pumping so hard. So the heart rate zone is important to monitor, especially if you're just trying to get into exercise. And the sort of rough formula is 220 minus your age. You should not exceed that for long periods of time. So if you're 40 years old, that would be a heart rate of 180 beats per minute. That's a little too high. You kind of want to stay at about 80% or less of that for the most part. But that's a little complicated because it also depends on where you're starting and how healthy you are. So I like to say, if someone is standing next to you, Jordan, if you were exercising and Corey was standing right next to you, could you talk to her in a few short sentences?
A conversational pace.
Yes.
Yeah, okay.
Or are you so short of breath? So you don't want to be, having a long conversation here. You want to do quick, short sentences. Because if it's a long conversation, you're not pushing yourself hard enough.
That's true.
We would never get anything done if we
I
were
was about to
working out
say,
with
and we're
each
so
other.
animated. We'd be so out of breath, right?
Just talking, no
Yeah,
working out, right?
exactly. All right. Dr. Kohli, thank you so much for
you.
your advice. We appreciate it.